Hi, I'm Dr. Ken Berry, family physician, and for the next few minutes, I'd love to discuss with you a very important topic, and that's childhood diabetes and the 11 warning signs that every parent and every grandparent should know about to look for so that if their child or grandchild is going to develop childhood diabetes, you will catch it as quickly as possible. If you know a parent or grandparent interested in a video like this, please share this video. There's a share button down below this video. You can click and share this on Facebook, Instagram, Twitter, wherever you share videos. The issue with childhood diabetes is that it often goes on for months and months and months undiagnosed. Now, pediatricians and family doctors are looking closely for childhood diabetes, but they only see your child once or twice, maybe three times a year. And if there are no symptoms or signs during that office visit, then they've done their job. But you as a parent, you as a grandparent need to know these 11 warning signs that your child or grandchild may be developing type 1 or even type 2 diabetes. These symptoms and signs could apply to either type 1 or type 2. Type 1 obviously is going to occur typically earlier in life, and it's going to occur in a more slender child on average, but not always. So let's go through these 11 warning signs that your child or grandchild may be developing diabetes. Number one is increased urination. Now, you are around your child and you know how often they urinate during the day. What you're going to notice is that they start to urinate far more often. And so instead of urinating every few hours during the day, they're going to start urinating every hour or even more often. This is a huge red flag that they need to go see the doctor and get the lab work checked that I'm going to tell you about at the end of this video. Number two is increased thirst. Now, if they just came in from playing on the playground, they're going to be thirsty, and that's normal. The thirst I'm talking about is a ravenous thirst that makes them drink a gallon or 2 gallons of water every day, and you'll just be able to compare their thirst versus the thirst of other children when they come into play. The other children get a glass of water and they're done. Your child just keeps gulping the water. That could be a sign that childhood diabetes is coming. Number three is increased hunger. Now, when a child goes through a growth spurt, they're going to eat more, and then they'll have that picky, finicky period where they won't eat much at all. This is a very different thing than growth spurt hunger. This is a ravenous, almost unquenchable hunger that you'll notice they're eating you out of house and home, and they're also not gaining weight from all this extra food. They're not getting taller, they're not getting heavier, they're just eating all this food, and it just seems like it's disappearing and not leading to a bigger child. Number four is changes in mood and irritability. This is always a red flag, even if it's not diabetes, especially in younger children. Often they won't be able to tell you exactly what's wrong or what's going on. You'll just notice that their mood gets bad. They're irritable, they're sad, they cry much easier than they normally do. That could be a red flag that childhood diabetes is coming. Next is blurred vision. Now, if a child's older, they can tell you, Mommy, when I look at this, it's blurry. I can't see the letters or the words, or I can't see your face. You look blurry. But a young child might express this as, I have a headache. My head hurts, because they haven't developed the verbal skills to say, your face appears to be blurry when I look at it, and it didn't used to be that way. So anything that tips you off that your child's vision may be much blurrier than it was a few weeks or a few months ago could be a red flag for childhood diabetes. Another is fatigue. Now, a lot of kids will go through growth spurts and they'll sleep all the time, and then they'll not sleep. What this is just a day long, day in, day out fatigue. They're not getting up and playing with their siblings or with their friends. They just want to lay around all the time. And this doesn't apply to teenagers. They all want to do that. This is for younger children who typically you couldn't get them to sit still. All they want to do is lay still. And that is a red flag for diabetes, as well as many other potential medical conditions. It's time to go see the doctor. Number seven is a big one, and that's weight loss or lack of weight gain. And so if we go back up to number three, that increased hunger, they're eating like a horse, as we say here in the South, but yet they're losing weight, or they're just not gaining any weight at all, or they're rail thin, even though they eat like horse. Though those are kind of classic signs that childhood diabetes may be something that you and your doctor need to consider together. Next is bedwetting or regression. And so this would obviously be after your child is potty trained and then they start soiling their pull-ups again. That's a regression. And that's anytime a child has a physical, medical, or mental condition, one of the ways they cope with that is regressing. And so if your child used to suck their thumb and they stopped, and all of a sudden they're sucking their thumb again, that could actually be diabetes or a host of other medical or mental issues going on. If your child starts bedwetting again, they haven't done that in months and months or a year or two, and then all of a sudden they're wetting the bed every night. That could be many things. It could be bladder infection, which also could come from childhood diabetes, or it could be childhood diabetes. Number 9 is a fruity smell on their breath. Some people describe this as like fruit, a fruity smell. Some people describe it as like a rancid fruity smell. Some people describe it as an acetone smell, like nail polish remover. Now, if your kid just ate a bowl of strawberries, they're going to have fruity breath. Don't worry about that. This is after your child hasn't eaten for a few hours and they happen to be close to you and they have this fruity or acetone smell on their breath. That could be a sign that they're in ketoacidosis, one of the most dangerous things that can come from type 1 diabetes in a child. Number 10 is that your child starts to get repetitive infections of any kind, really. So you had this previously very healthy child, and now this child is getting yeast infections once a month, once every 2 months, or they start getting repetitive ear infections or repetitive sinus infections, just any kind of infection. Or if they get a little cut and instead of it healing like it should heal, it takes forever to heal, or it gets infected. Any of those things are red flags that something is going on that's not right with the immune system, and that could come from childhood diabetes. Number 11 is dark patches of skin on the neck or in the armpits. This is called acanthosis nigricans. I actually have a video about that if you want to learn more about it. It'll pop up either here or here at the end of this video. But that is an indication that your child is insulin resistant and probably is either pre-diabetic or is developing diabetes. Now, these 11 signs are kind of the classic things that a doctor would look for, but unless you have a doctor living with you, you need to be aware of them as a parent or a grandparent so that you can look for them. And I don't want you to worry. I don't want you to obsess over this, but you do need to know these. So if you see one of these and it happens rarely, it's not a big deal. But if you see multiple ones of these signs and they keep happening over and over, it's time to go see your pediatrician or your family doctor, and it's time to get some blood work drawn. And that's going to involve a needle, and your child probably won't like that. But I promise you, what they'll like less is having undiagnosed diabetes. It destroys a child's life and their future. You don't want that. If they have diabetes, you want to know as soon as possible. And so the lab tests that your doctor hopefully will check and definitely should check are a urinalysis to look for any signs of infection or sugar coming out in the urine, a complete blood count to help look for any signs of infection or bone marrow disorders, a complete metabolic panel looking at the kidney function, the liver function, and lots of other things as well, a hemoglobin A1C to see if their blood sugar is being elevated at all on a daily basis. Obviously, a fasting blood sugar will be part of the CMP. They also need to have a C peptide checked, and this definitely goes for overweight children who you suspect are developing type 2 diabetes, because long before the A1C or the blood sugar will start to elevate, the C peptide will start to go up because their pancreas is having to work double time and triple time to put out more and more insulin to cope with the sugar, the glucose that they're having trouble coping with. That's just a limited amount of labs. They might need more check than that, but they definitely need at least that much to rule out diabetes or prediabetes. And then when I say diabetes, I mean either type 1 or type 2. Those labs will tell you if they have one of them and which one they have. And so I hope this video has helped. Feel free to share this. If you enjoy videos like this, please click the subscribe button. It's right down there. And the little bell button right beside that. If you click that bell, then every time I get a bright idea, YouTube will send you a notification and you'll be one of the very first to know. That's it for this video. Thanks a lot for watching. This is Dr. Barry. I'll see you next time.